Your healthcare provider has determined that you have or are at high risk of developing diabetes. Being worried is normal, and you probably have a lot of questions. We have the answers. Take a look at this short presentation. It will tell you what diabetes is, how it is diagnosed, how it is treated, and how you can improve your health and reduce or avoid the risk of type 2 diabetes. If you have questions after watching this short video, your healthcare provider will be able to help. First, what exactly is diabetes? Diabetes is a disease where blood sugar levels are elevated above normal. There are several reasons why a person may get diabetes. It happens when your pancreas, which is part of your digestive system, is not producing enough insulin. Insulin is an important hormone which is helpful in regulating your metabolism. Diabetes may also be caused by the cells in your muscles, liver, or fat being unable to use insulin properly. The end result is that blood sugar, also known as blood glucose, is increased, while cells don't get the energy they need. Nearly 10% of the U.S. population has diabetes. The question is, how does diabetes develop? First, your body needs insulin. When you eat, your body breaks down sugars and starches into glucose, which in turn fuels your cells. Next, the insulin in your body takes glucose from your blood into your cells. When the glucose your body has created builds up in the blood instead of fueling the cells, you get elevated blood glucose and less energy. Elevated blood glucose is what leads to diabetes. There are two types of diabetes, type 1 and type 2. You might have heard the term juvenile diabetes. That's type 1 diabetes and is diagnosed in children and young adults. Type 2 diabetes, which used to be called adult onset diabetes, is the most common form of diabetes. And type 2 diabetes is what we are referring to in this video. Diabetes is on the rise. In fact, between 1980 and 2005, the number of cases in the United States nearly tripled. And those numbers will continue to go up if we don't make healthy lifestyle changes. So how do you know if you have diabetes? There are a number of symptoms to keep an eye on. Some of these symptoms are frequent urination, extreme hunger, extreme fatigue, cuts or bruises that are slow to heal, and recurring infections. However, diabetes is often silent at the onset and may be diagnosed by laboratory data obtained by your doctor. Diabetes can also lead to other health complications because high blood glucose, also known as hyperglycemia, can damage nerves and blood vessels. How does your healthcare provider make a diabetes or prediabetes diagnosis? There are three ways: a fasting plasma glucose test, an oral glucose tolerance test, or a random plasma glucose test. These tests, along with an assessment of symptoms, is used to diagnose diabetes. Let's talk about prediabetes first. Prediabetes happens when blood glucose levels are elevated, but are not high enough for a diagnosis of diabetes. Many who are diagnosed with prediabetes will develop type 2 diabetes within 10 years. A diagnosis of prediabetes can mean an increased risk of heart disease and stroke. The good news is, a change of lifestyle can help delay or even prevent type 2 diabetes from developing. Now, how do we treat and manage your diagnosis? There are 3 steps: changing what you eat, developing an exercise program and regular physical activity regime, and appropriate medication, which can include pills, injections, and in some cases, an insulin pump. An important phrase is glycemic control. This means getting your blood glucose levels in control. To check this, your doctor will use the hemoglobin A1C test. This is a blood test also called the A1C. The A1C is generally checked every 3 months. It allows you and your doctor to monitor your diabetes control. Generally, an A1C of 6.5 or below is considered good. So how do we prevent diabetes? Recent studies have determined there are several important steps. Reduce your body weight by 5 to 7%. Follow a low-fat, low-calorie diet. Avoid sugars and choose foods high in fiber such as vegetables. Switch out white starchy foods for the whole grain variety. And importantly, adopt a program of regular physical activity for 30 minutes, 5 or more times a week. It's time to review what we have learned. First, a diabetes diagnosis is made by checking blood sugar, also known as blood glucose levels. And there are 3 ways to test for diabetes and prediabetes. Your doctor will determine the best test to use in determining if you have diabetes. And if you have diabetes, which test to use to monitor your diabetes. It's a good idea if you are over 45 to be tested for diabetes or prediabetes. Remember, if you are diagnosed with prediabetes, there is a good chance that diabetes can develop within 10 years. Weight loss, physical activity, and a low-fat, low-calorie diet can help delay or even prevent type 2 diabetes. Thanks for watching. We hope we've answered some of your questions. Your healthcare provider will be with you shortly to continue the conversation about this important topic.